replay. Welcome to Mobility Magic. If you were just tuning in right now for your first session of the week for Good Life Fitness live sessions, this is Mobility Magic with me, Simon Page of the Good Life Fitness personal training team. Hello and welcome to Mobility Magic again. Today we are going to be doing a predominantly hip and lower back based session. So a little bit of ankle work, a little bit of hips and low back, and we're doing some feet as well just to start off. So great to see you. Hello to you from Kitchener, and hello to everyone else. And hello, we'll just let a few people come in. As I say, we're going to be focused a little bit more on lower body today. We're covering background, covering some very basic essential stuff. If you tuned in for the first time, this would be an awesome session for you to get started with us. We're every Monday at 11:30, and if you have any comments, any feedback, anything you'd like us to cover, you can turn the comments off there. Please leave it in the feedback for the video we'll post straight afterwards of this video. You can leave a comment underneath and we'll get back to you with any help you need or any feedback you have for this session. So only this session. I will start off by saying that today you will need a lacrosse ball as usual, or a tennis ball, or something to roll your feet with. You also need a foam roller. And I've left my bench out here. You can also use a chair, or if you're in the living room, you can also use your couch for a couple of the items as well. And you might need something for your knees if we're on the floor as well and you have a hard floor. So without further ado, we're going to get started. And the first thing I'd like you to do is grab your lacrosse ball / tennis ball / something to roll your feet out with. We like to start with this because this tends to help kind of loosen up our feet a little bit, as well as kind of loosen up our low back. If you have any opportunities in your feet, your calves, your ankles, and your low back, this tends to be a key to unlocking that area. So, going to start off with the ball under our feet. Don't want to be too aggressive with this. Again, we're just looking for a light release of the foot, any plantar fascia kind of tissue that's kind of built up tension. Just want to release that. We're going to start at the base of the big toe. So if you've done this one before, you kind of know the score. We're just gently pressing into the tissue. We're just letting it relax. You don't want to feel pain. You just want to feel a mild kind of discomfort or stretch on this one. So a little bit of light pressure. We're going to press down, and we're going to want to make sure that we are keeping our chest nice and tall, so the pressure is just basically down into the foot. And we're going to start to move into the middle of our foot. So now we're below the 3 middle toes and kind of below the knuckle of the foot there. And we just bring our toes up and down. So that's another thing you can do, is add a little bit of a press into the ground, stretching the toes. We're trying to stretch away from the point of contact with the ball on the foot. And again, you can use anything you like with this one that's going to work for you. Some people like to use a barbell in the gym. That can also work. As long as you clean it afterwards. And also dumbbells do work as well. Lacrosse balls, tennis balls, even a plastic bottle will work for this one too. Just anything that's round and will allow you to put some downward pressure with your foot on top of it. Works really great. So again, all we've done with this one is we pin down the tissue below the knuckle. We've brought our toes up and down just to kind of stretch the tissue away from the toes. We're now going to add a little bit of a roll from front to back in, just very gently. Doesn't need to be too quick, not too aggressive. We're just moving front to back. We're just trying to see if there's any areas of opportunity. And when you do find one, if you do find one, we're going to pin it down. So I'm just going to imagine I found one. It could be anywhere on the foot. We're going to pin it down, and we're just going to hold that pressure just for about 30 seconds. So you're pinning the area down. We're just trying to get that tissue to diffuse, just kind of relax. It doesn't have to be an aggressive roll that a lot of people do, because again, we don't want to bruise the area. We just want to release it. And now you can start to bring your toes up, start to pull them down to the floor. We can find a new area for it releases. If not, frequency is king with this one. That's what's going to work really, really well. If you start to do it quite aggressively and you bruise your feet, that's going to hurt way more, which is not what we want. So now we're at the heel. We're just below the heel, and this is commonly an area where people find they get that plantar fasciitis, that really painful area. So just be light and gentle with this one. Again, apply a little bit of pressure and start to bring your knee over that area, just changing the pressure. So again, heel, not too much pressure, but if you can do it, just add a forward knee bend over that area, applying downward pressure into that area. Just forward knee bend just adding pressure forwards. You can also bring the toes up to the ceiling, just roll that heel out a little bit and see how that feels. So now let's move on to the other foot. If you follow what we did the first one, if you know what to do, skip ahead obviously. I know this seems a little bit basic, but trust me on this one, if you start with this area and you kind of follow through with the other stuff we're doing, this will give you a quick reward for loosening the feet. It also feeds back up into the head as well, so it kind of connects all the way through. So toes up to the ceiling, stretching the toes up. If you feel it in your calves, that's also great. And we're just going up and down, up and down. You can also roll your foot in and out, so we're kind of turning our foot, inversion, eversion. We're just kind of turning in and out. And we're just going to move to the middle of the foot. So now we're below the base of the knuckles of the 3 middle toes. And just apply a little bit of downward pressure, just to kind of see how that feels. Sometimes this works really great at unlocking the ankles. Sometimes it works really great at unlocking the calves. Sometimes this really works well for the hamstrings and glutes. And sometimes you might even find that your neck and shoulders start to unlock as you get a little bit more mobile in the feet. So whichever works for you. If you don't find this helps at all, then obviously you don't have to do it, you can skip ahead. You can skip ahead to the next section. We're just going to start to add a little bit of a roller now. So if you've done your little toe, if you are bringing your toes up to the ceiling, you're pulling down to the floor, that's fine. We're just rolling our feet just a little bit there, and we're going to move around in circles. We can even pin the foot down, and we can even start to turn our foot. We can turn internal and external rotation as we push down into the floor with a little bit of pressure. That can also help, and we can also turn our knee in and out as well. So a few options for you there. Just find what works best for you, essentially. So now we're on the heel, pushing down lightly. We're just seeing how that feels. Bring our knee forward slightly with that forward pressure, just to see how that feels. So now we're going to come down, we're going to move the ball out of the way just for a minute. We will return to this in a second. We're also going to use our foam roller in a minute. And we're just going to stretch our toes just by putting a little bit of downward pressure. So I'm just bending my toes lightly. I want most of my weight on the back foot, but I'm just adding a little bit of pressure downwards just to get a bit of a stretch through the front of my shin. That'll become important later. And we're just trying to get a little bit of a stretch there into that big toe. Try and use a little bit of pressure, but not too much, because this is a common area where people are injured, it's the big toe. And we're just going to roll out to the little toes, rolling out to the outside of the foot. If you can manage it, if you can bear it, just a little light pressure. You can even do this on sitting if you want. Now we're going to change over to the other foot. Again, just a little light pressure. We're just going to push down into the outside of the little toes, and we're going to come around. We're just going to start again, down pressure, trying to get a little stretch through the front of the foot into the shin. So next thing we're going to do is we're going to come into a calf stretch. So you need a wall. This can be really light and effective, but we're going to lunge forward. Our front foot is close to the wall, our back leg is away, and the first thing we want to do is just start to lean our hips forward. We don't want to arch our back too much. We just want to lean forward, putting pressure down into the floor, keeping contact with our toes, and we're looking for a stretch on that back leg. So as we do this, one thing we can do to add a little bit more of a stretch is just imagine we're pushing our toes into the floor. So we're really pushing down into the floor. We're pushing down, 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 down. And as you relax that foot, we're now going to lean forward a little bit more. You find a little bit more range and a little bit more of a stretch through the calf. Take a nice deep breath in. Pushing our toes down, 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 down. And relax. Push our hips forward. We are pushing our toes down, 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 and relax. And again, we are pulling our toes up to the ceiling. So our big toe, we want to try and get it off the floor if we can, and we're just leaning our hips forward. So what will happen is you get this inhibitory response, you get a little bit more range in the calf. Just roll it out, see how that feels. And now we're going to move on to the other side. So again, back foot is flat on the floor as far as you can get it. If you only have the range to be about here, that's completely fine as long as you can shift your hips. If you want to come back a little bit further like me, that's completely fine too, as long as you have a hip stretch and there's no bend in your knee. So for this one, keeping our chest nice and tall, we're leaning forward over that big toe. We're going to apply a little bit of pressure into the ground with that back foot and engage that toe into the ground, creating a little bit of a stretch on that calf, and then we're relaxing. And as you relax, drop that hip forward, and relax. Just do it one more time. So we're pushing down to the floor with that heel, with the back foot. We're applying some pressure with that big toe. Feel a little bit of engagement and stretch. Pulling that hip forward, relax, and feel the stretch. And if you want to add some more range with that one, you can. So you can always bring that foot back a little bit more. Okay, so next we're going to move on to is a quad roll. So you're going to need your foam roller. We're coming down to the floor. This is just to start to open up the front of that hip, and we're then going to move into a bit of a couch stretch using the bench. So easy way to do this, there's two ways in fact. You can use a foam roller, or you can use a lacrosse ball. I will give you the option of either, and I'll quickly show you both variations. So the first thing we're going to want to do, actually I'll put that down, is we're going to want to lay across our foam roller. I want to have it kind of the start of our thigh or just above the patella. I want to be a couple of 3 or 4 inches above there, just so we're not on the tendon. So lay down so you can see. We're laying across the foam roller. We want to be, as I say, about 3 or 4 inches above the knee and tendon, so we're not on any delicate structures, and we're just going to start to bend our knee until we feel a light stretch. So a little bit of a light stretch. Now you can internally and externally rotate a little bit, and if you hit any of the adductors as well, that's also a bonus, so that the muscles on the inside of the thigh. And you can externally rotate, and you can also bend all the way up. And if you want to modulate the pressure, you can just lift your hips up a little bit, apply some downward pressure. Now we're going to try and fully extend our leg as we bear down that weight and bend fully and straighten fully. So we're getting that terminal extension, that excellent bend of the knee. You can also start to release those quads too. So you want to make sure that you're turning in fully and out to the side as well, just to see which one's most tight. Sometimes you find that vastus lateralis, the one on the outside, that muscle can be the tightest one. You might even find it kind of bubbles or moves as you bend that knee. And as we kind of come in, that vastus medialis is going to be the one that kind of hits on that one, and you may need to apply a little bit down pressure. So again, you can do terminal extension, which is where you extend your leg, or you can bend that knee, turning the leg inwards and outwards. So let's do the other side. You can spend as much time as you need on this one, and I'll also quickly show you how to do that with the lacrosse ball too, so you can be a little bit more targeted. But we're going to lay across the foam roller. I want to target about 3 or 4 inches above the kneecap. We're applying a little bit of downward pressure. So excuse me while I'm slightly off the screen, off shot there. But I'm lifting my knee towards my butt, pushing my hips slightly off the ground to add a little bit more pressure. It's going to start to ease and to help stretch that position. As I bend that knee, I'm now going to start to internally, externally rotate that knee. You may even find a little bit of a pressure on the inside towards the adductors. I'm going to turn my hip and lift my hips to the side. I'm then going to bend a little bit to add some pressure. And then I'm going to fully extend to get that terminal extension. Maybe feel a little bit more pressure that way. And then I'm going to bend, just backing off the pressure. So you have to kind of gauge and modulate where you need to. You just don't want to cause any damage. You just want to have a light stretch. And when you're ready to disengage. So if you have a lacrosse ball and you want to go a little bit more focused, you can. This can be a little bit more intense. So if you're just starting on the foam roller and you find that works for you and that's a lot of pressure and you feel uncomfortable, you may want to skip ahead on this one, or you may just want to carry on as I kind of go through the lacrosse ball focused stretch. So with this one, we can be a little bit more targeted. So if you can imagine, we're just going to hit each of the heads of the quad in different positions. You can be higher up on the inside and the outside, or a little bit lower in the middle. So we're going to start a little bit more towards the center of the quad, and we'll just do it on the one side, because then those that want to review it can on the video, and we can skip ahead to the next section. But essentially, we're laying on the floor, on lacrosse ball, and we're going to do exactly the same motions. The reason this can be a little bit more intense is obviously we're targeting down a little bit more in the area with more pressure. It's kind of a harder pressure as well, more focus. So we're just basically trying to kick our butt and then trying to fully extend that quad. And as we try and bend that knee, we start to lift our hips off the floor to get some downward pressure into the area. Once we have some pressure on the quad, we can then do the same thing we did on the foam roller, just turning in and out, making sure that that ball doesn't move off the spot we're pinning down, and then we can move to another spot, staying off the middle of that kneecap tendon area. So if you find the ball starts to move around, that could be because you found that knot that you're looking for, or maybe you need to go looking for it. So we're now focused down, start to pull back towards our butt, and then we're starting to extend as we apply a little bit more pressure. Down, 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 down. Get to a little bit more terminal extension, and we're engaging the muscle. And then you can do that on the outside too. Hopefully that works for you. Again, you can do that same movement. So again, just to review, placing the ball or placing your quad on the pressure point of the ball or the lacrosse ball, we're going to engage our hamstring to pull the foot towards our butt. We're then going to engage our quad and try and fully extend that leg, get some focus down into the area and see if that muscle starts to relax and release. Next thing we're going to do is bring our knee onto our bench, or if you're in front of the TV in the living room area, we're going to grab the couch. And you may want something for underneath your foot, so maybe grab a pillow, or maybe grab a foam pad. I have a foam pad, so I'm going to use that. And with this one, I like to place it down because it just helps to add a little bit more of a padding for my knee. So I'm bringing that foot back. I'm going to put my front leg out. You can gauge how far you want this stretch to be. So if you find that, and I'm just coming to the side slightly so you can see, if you find that this foot is uncomfortable, you can always bring yourself a little bit more forward, because the stretch is going to be engaged or gauged by how far back you bring your hips towards your foot. So, nice tall position. I have my foot on my bench. If you're in front of the TV and you have a couch, just place it on the couch in a comfortable position. The more vertical your back foot is, and the more 90 degrees or less that your front foot is, the more you feel the engagement, the stretch. The other thing you can do is make sure that your hip on the stretching side is coming forward as well. So let's start with this couch stretch. We're going to drop or shift our hips forward. Shifting our hips forward, just so you feel that light stretch on the side that we're trying to stretch, first of all. Now we're going to bring our chest up and our arm up, and we're starting to lean our chest back and turn our chest out. So now you feel it move all the way up through those quads into that hip flexor area, through into this low back as well. And then we come back to center. So we're just starting to turn up and out. And as we do that, we're just stabilizing, if you want to, with this front hand on the leg that's bent. This is just to kind of open up that region. We're not moving fully into the stretch just yet. We're just starting to open it up. Now let's take a break. Let's switch legs. So a couple ways to do this. Be as graceful as you can. If you need to disengage, stand up, come back into it, that's completely fine too. If you need to straighten this leg because it feels uncomfortable, that's fine too. Any cracks and pops, completely fine. And again, we're just starting to ease into the stretch if there's one side that's more uncomfortable than the other. So now we're moving into this hip flexor stretch. Now we're just reaching up, bring our chest back. We're turning a little bit towards the center, so I'm coming this way, leaning forward with this hip, leaning back with my chest. Should feel a good stretch through that hip flex on the front, a little bit into the quads that we just worked on, releasing. And now if you can manage it, you're just going to lean your chest back, start to get your butt towards your foot towards your butt, and we're just leaning as well. So if you feel there's too much pressure on that knee, you can lean forward a little bit onto this other leg. If you feel there's not enough pressure into the area you're trying to stretch, then you can obviously lean back. But the taller you can get, the better. So if you reach up to the ceiling as high as you can get, that may also help you as well. So let's come back to the first leg. We're going to move the knee a little bit closer to the bench, try and get this back leg a little bit more vertical. The more vertical you can be, the better. This front leg is going to be, as I say, about 90 degrees. We're reaching up to the ceiling. We're turning our body out. We're stabilizing this arm. Front leg. We're leaning our chest back. And we're coming back down. Now we can add a little bit more of a dynamic stretch to it if you want to. It's also really good before a workout, because anything dynamic is great. You can also do this more static if you want to, if you're just doing it after a workout recovery or you're on your recovery day. We can also drop this hip to the side slightly. So now we're reaching over the top. Should feel it intensify this lateral stretch as well. And then come back. Nice deep breath in. Always moving with that. Exhale, deep breath in. And we move through that lateral stretch into that low back and hip, and also into this front net as well. Let's change sides. So again, nice tall position, reaching right up. Leaning our hip back, also our chest back on our hip forward. We're now leaning across, so as we stretch up and over, we're just leaning, pushing our hip out this way and making sure that we're as tall as we can be. So the more vertical we can get this line, this hip, all the way through, reaching up, the more vertical we can get it, the better. As we reach over, I'm trying to push this hip out, I'm trying to get this stretch through the front and lower back. And I can create a little bit more dynamic movement as I kind of combine it all in one movement. And if you want to come all the way through and around, you can, as that shoulder in as well. So there's a couple of options for you with this couch stretch. It can be a really intense stretch. A couple of ways that you can modulate it. If you want to make it harder, you can use a wall. You can just literally back yourself up into the corner. Make sure you have something underneath your knee. I find that, carpet and hard floor can often be really uncomfortable. And the aim is that we're getting a nice deep stretch on the front, maybe into the hip flexors too. If you need to lower it down, you can also use something lower to the ground, like a foam brick or a foam roller. So next stretch we do, just going to get rid of this pad, is we're going to come down to the floor and we do our classic core 4 circuit. So we're doing a few moves to loosen up the hips a little bit more dynamically. So let's start with our hips dropping to the sides. So we've gone side to side just to do a quick check-in. We're going to drop our front hips. So let's start with our left today. You normally do our right, but we start with our left. We're going to go about less than a 90-90. So I'm going to face you so you can see. This is more of a dynamic kind of stretch. You can also do this a little bit slower, and this can be kind of your restorative or post-workout stretch. So if you want to do it a little bit more dynamically, we're going to reach up with our chin, take a deep breath in, and we're going to come down. We're rolling our chin down like we're a wave breaking on the rocks. Stretch up. Breathe out. We'll lean forward. Rolling this head up. And we're trying to get as far as we can away from ourselves. So we're stretching forward. And back up. Stretching forward. Rolling up our chest. So we're rolling up our chest. We're then going to do that a few times dynamically just to kind of warm up. And we're then going to turn our body a little bit to the side. So we're creating a little bit of tension across the hips. And we're going to do the same thing. So the idea is we're stretching up as tall as we can. We're rolling forward and we're bringing that chin up our chest like rolling like a wave. So we're stretching forward, rolling back up. Should feel your spine lengthen. Should feel a stretch through the hip. Coming around again. We can breathe out. This may look a little bit silly, but it's really effective at just getting that body to relax and lengthen. We're trying to lengthen the spine, we're trying to get the spine and the hips kind of stretched away from each other, a little bit of light traction, which will be done with the breath and the movement. And then we're just going to turn one more time. So you could pick a few different positions to work through. The idea is that we're just creating a little bit of tension across the hips, which is getting the spine, the head away from the low back and the spine, kind of traction out. And let's move across just to create a little bit of space here so you can see. And we're going to add our arm in. So with this one, we're going to skip over kind of the last stretch just to kind of speed things up, but we're going to do a little bit of a rotation on the side just to open up that low back. Turn under, follow that hand all the way up. So we're going to breathe in as we turn in. As we turn in, we're going to try and keep that back foot pressed into the floor. Feel a stretch across this hip and low back. And now we're going to switch sides. So you should find that your hip should feel a little bit looser, a little bit different. We're going to see how that feels. So maybe your left now feels really loose, but your right feels a little bit tighter. That's a good sign. It means we could probably loosen a couple of things up. So we're going to grab our less than 90-90 kind of position. We're going to do that undulating wave-like motion, that stretch wave. We're going to stretch up with our head as tall as you can towards the ceiling, and we're rolling down across the front leg. And change positions. So we're just changing positions as we go. If you find there's an area that you're particularly tight, just make sure you're moving with that breath. Stretching forward. Back up, rolling up that chest. And then we're rolling forward. Moving around. So let's find another position. Probably 3 or 4 reps per side is really good at a good idea for this one. Deep breath in. Traction in that back out, that neck coming down towards the floor, stretching up, stretching over, traction up, back out, and probably 3 to 4 positions all the way around is going to be enough for this. So now we're coming down onto our elbow, we're turning our body in, stretching up, trying to create distance, as much distance as you can as we stretch up towards that ceiling. We're just pressing this back foot into the floor. So good idea here is just to do a check-in, just see how that feels for you, just see if there's any difference in the hips, and see if that's improved for you. So we've done our ankles, we've done a little bit of calf on the wall here, we've done a little bit of releasing the quad and doing a couch stretch, and we've done a little bit of releasing up his hips as well. So hopefully that should feel way, way better for you. One last thing I like to do for this one, because we've done so much work around the hips, and we want to make sure they're nice and stable before we finish. First thing we want to do is just reset our hips. You may also want to do some glute activation as well, some hip bridges. So you can also use a foam roller if you want to, or you can just use your hands. But I like to squeeze the foam roller as hard as I can, trying to pull these knees together, trying to create a little bit of tension across the hips, force those hips to be centrated or centered in the sockets. Also like to drop to the side, do the same thing. Squeeze, squeeze, squeeze. Other side, squeeze, squeeze, squeeze as hard as you can. We're trying to create some tension, bring it down to the floor. You can also do this with your fists if that's easier for you. And you can also come into a little bit of hip extension as well just to kind of help that movement. So we're just getting our butt and our hips to kind of work together just to create a little bit of stability here. If you want to do it one leg off the ground, you can. That also works great. Just creating some stability, because we've done a lot of mobility around the hips, and the stability is the last piece to the puzzle. So hopefully you enjoyed that one. Hopefully that's helped you with some mobility that you weren't aware that you didn't have. Hopefully your hips feel a lot better. I know mine definitely do. So same time next week, 11:30 on Monday. Be there, normal time, for a regular stretching session. If you have anything you would like us to cover in any of those, that session or in future sessions, feel free to leave a comment in the video that we post after this session. So awesome, thank you so much for joining me as usual, and I look forward to seeing you next week at the same time. Thanks very much. Ciao for now.